everybody. I want to introduce you today to Cassie McGee. She is a PA who graduated in 2015 from St. Francis University's PA program in Pennsylvania. She's worked in pain management family practice for 6 years before switching to dermatology in May of 2022. She currently works for the Polyclinic of Dermatology in North Carolina, and she enjoys traveling with her husband and recently returned from Italy for New Year's and spending time with her 2 beagles. So I hope you all will welcome Cassie with me today. And Cassie, I'm just going to turn the floor over to you. So I'll just give a quick introduction to sort of how we decided to sort of format today. So Cassie's going to talk about 4 specific topics. She's going to talk about PA school. She's going to talk about each of her 3 jobs that she's had. And so we're going to give about 15 minutes to each of those topics. So I'm going to let Cassie start talking, and then we'll switch to Q&A. And when we hit the 15-minute mark, we'll move on to the next topic, just so you all know. So be prepared with any questions you have for each of the topics as we go through. And then hopefully we'll wrap up in about an hour or so. So again, thank you, Cassie, for joining us today. We're so glad to have you.
Thank you. Thank you for having me. Thank you for the introduction. So I'm going to talk about a couple of different things. I kind of have a long journey through PA school and being a PA. So I'll kind of go through a couple. And if anyone has questions along the way, just stop me and I'll answer them along the way. So I first decided, actually, I wanted to be a physician assistant in high school. I had a friend whose dad was a PA. And I knew I wanted to do something medical. So I shadowed him a couple days and kind of decided that was the route I wanted to go to. So when I was in high school, I think I applied to like 10 different colleges. A couple of them were pre-PA. So that would consist of 5 years, which is a 3+2 program. So 3 years of undergrad, 2 years of graduate. And in doing it that way, which I don't know how many colleges do it like that. I know my college was in Pennsylvania. So a lot of PA schools in Pennsylvania are formatted like that. But you're a PA from the very beginning and you stay all the way until you graduate, pending that you can keep the grades up. So I applied to about 10 different colleges, and I did not at first get accepted into any of them. So it's very, very competitive. I think for my class in the college that I got accepted to, I think maybe they took like 60, 70 people. So, and that's like about 2,000 people applying. So they take about 60, 70, very hard to get into, but I didn't get accepted initially to any of those schools, and I accepted a different college, and I kind of said, you know what, I'll just do an undergrad in health science and then I'll apply to PA school afterwards. And after I had already put in my deposit and was accepted at one of the colleges for a bachelor's of health science, another college came back that was pre-PA and said, hey, we have a spot open, do you want it? So of course I kind of gave up my deposit at the other college and went to St. Francis University, which is right outside of Pittsburgh, Pennsylvania. So I was very lucky in that since I got in from the very beginning. And like I said, it was 5 years, so 3+2. And along the way, I did not have a lot of shadowing experience besides my friend's dad that was a PA in high school. So along the way, you're taking PA courses all the way up until graduate school the last 2 years, and you're doing shadowing as well. So that's where I got all my shadowing and medical experience in before grad school, was doing the shadowing. And my college worked with a local hospital, and they kind of had rotations where like every Friday or every other Friday, they would send students to go and shadow. So that's how I got my clinical hours before that. The last 2 years, we do go continuously. So that would involve a summer semester. So the last 2 years are continuous to kind of make up for that 6th year of getting a master's degree. So trying to think of anything else during PA school, undergrad. I think that's it, just kind of taking the pre-PA classes. And then of course I got to graduate school, and graduate school was a whole year didactic year of sitting in the classroom learning. And then the last year's clinical rotations. So at the time, my college was awesome and we could pick to go anywhere for our clinical rotations that we wanted to. Granted, we could find some clinics that would take us and allow us to be shadowing there for about 5, 6 weeks. And at the time, my husband was stationed in Missouri, Fort Leonard Wood, Missouri. So I got most of my rotations back there in Missouri, and I found a couple clinics that would take me. So I was doing 5 or 6 week rotations there, driving 13 hours back to Pennsylvania in between doing my tests until I finally graduated in 2015 with my master's. So after I graduated, I took about, I'd probably say it was like 9, 10 months off. My husband actually got stationed in Stuttgart, Germany. So I moved with him there for about 9, 10 months. And the goal was initially to try to find a job on base there, but they only had about 3 or 4 physicians there. And if I wanted to get a job, I would have had to go off post. And of course, not being able to speak German, that would be really hard to do. So I basically just from that point on started looking for jobs and kind of moved back stateside. So that's kind of my journey from high school on to through PA school. I don't know if there's any questions, anything that I missed and talk about in regards to PA school.
If there's questions, you can either put them in the chat box or feel free to just unmute yourself and ask. Any questions on that? I know the 5-year program is something that does seem to be growing in more common. I don't know how common. I didn't look it up, but as I told you earlier, I've had a few clients in the last year or two that are applying to those 5-year programs. Seems really like highly expedited. How did you feel prepared? Did you feel really well prepared for your exams and stuff?
I did. And the professors that we had for undergrad were the same ones that taught in graduate school. So you're familiar with them, and they were awesome professors. So we were really prepared. And I essentially had, I think of it as like 5, 6 years of PA school, because we're doing all those undergrad classes, which are all pre-PA, and we're learning stuff rather than just the 2 years of graduate. So I felt very, very prepared. Of course, doing the clinicals and everything in undergrad as well, it helped a lot. And I know we had, when I first got to college, I want to say we had like 80 or so, and probably had about 20 or 30 not make it because of grades by the end of the 3rd year. So whatever is left, however many people don't make it, that's how many transfers that they will accept into the graduate program the last 2 years. And I think in my year, we only took, I want to say it was only about 12. So out of like thousands of people that are applying, we only took 12 transfers in for the graduate year, which is crazy.
Yeah. So what was your undergraduate education like? Because it was all PA courses. So were you not doing things like languages and writing and, the more well-rounded education that people typically get in a 4-year college situation?
Yeah, I did. I have some undergrad. I had to take one language class, but most of it was science and PA. I don't think I had any math, which of course I had a college class in high school, calculus, that I took. So I don't think I had to take it at that point, but there was no math. And of course there was a couple, like we had to do speech class, language class, like I said, a couple that were required, but other than that, it was mostly all science and PA classes specifically. So, yeah.
So what do you mean by PA classes? Can you give an example of what a PA class is?
Of course. So a lot of, and this is me, sorry, trying to think about, go back a couple of years and think about what those classes entail, but a lot of it was terminology. I remember like the very first semester was terminology, anatomy, of course. I believe that we did even have to do, I think the cadaver class that we had was our 3rd year. So that was an undergrad as well. So we have about 1 cadaver a year at my university, and that would be for the PA school. So we were doing anatomy and also going in and dissecting the cadaver as well, and learning everything. So it was a lot in undergrad that we're learning before we even got to graduate school.
Oh, that's really cool.
Yeah.
Okay. Any other questions for Cassie about PA school, the 5-year program? Okay, if not, why don't we move on to your next topic?
Okay. So after I could not get a job on post in Germany, I decided that the student loans, it was time to start paying on my student loans and I had to come back and start working. So I had used Indeed and just started applying. I'm originally from Buffalo, New York, but we knew we wanted to be more in like the North Carolina, Tennessee area, just weather wise. And it's the area that we liked. So I started applying really just all over the state of a couple different states around the Midwest and the South. And the first job that I got, I probably would say I applied for about a month to a couple different jobs before I got a pain management job out in Missouri. And everything that I did was all over Zoom, like the interview and everything for that job, which I kind of needed a job that would kind of just, I could do everything over the phone because I wasn't able to fly back multiple times to the States for interviews and whatnot. So it was a pain management job that I took, and I was there probably about 10, 11 months. And really, that was just my first job to kind of get like my feet wet in becoming a PA and kind of, get stateside and learn what it is to be a PA. The clinic that I was at, pain management, they had about 3 or 4 clinics, and it was not very independent in regards to, I was seeing a lot of the patients, but the doctor was signing off on everything. So I did not have my own DEA number. I was not really doing changes to medications. I was basically doing the paperwork and kind of pushing that folder over to the doctor for him just to sign off on. So I knew that I did not want to do that very long. And like I said, it was kind of just to get my feet wet and get a PA job where I could kind of set up and look for what I really wanted to do. So at that point, I again used Indeed to apply all over North Carolina and Tennessee again. And I ended up getting a job at a family practice in Troy, North Carolina, which is a really small little rural town outside of Charlotte, North Carolina. So that was about March 2017 that I moved and started that job. And I was there for 5 years, loved it. That's where I really would say that I started to become way more independent and learn a lot more. Of course, we all graduate and we have all this information in our brain and we learn all this stuff, but it's not till you're on your own prescribing medicine and doing physical exams and making decisions on your own that you really start to be like, okay, I know what I'm doing. So that's probably when I thought that I felt more confident. And the family practice that I was at was considered, like I said, it was a rural health clinic, and we were one of the only family practices in all of the county. So because of that, it was very, very diverse, and I loved that. So I actually did addiction medicine while I was there. I did hepatitis C treatment. I did Botox, laser hair removal. We did aesthetics as well, which was very interesting, and I loved that. And then, of course, family practice, so high blood pressure, diabetes, managing everything like that in between. So we didn't really have pediatrics at the clinic, but it was pretty diverse in everything else that we did. And I really liked having a big, diverse area of things to do because in regards to keeping up my medical knowledge, I was like, this is perfect for being able to, when I have to recertify and take my boards at year 10, this will be good. I'm kind of learning everything and staying on top of all the information. So I really liked that at the time. And then the clinic that I was also at, because it was a rural health clinic, they did submit me for a program to have some student repayment done, which I know there's different areas all over the country. If you're working in a rural health, some government programs will actually pay a portion of your student loans to work in those areas. So I was very fortunate to be able to have like a little bit of assistance as far as student loans in regards to that as well. So I think that is about everything before I kind of moved on to dermatology. If there's any questions about family practice and the pain management.
And again, feel free to put your questions in the chat box, or you can unmute yourself and ask live. Guess maybe we'll be saving questions for the end, I suppose. So questions on pain management or family medicine? Last call. So what I heard you say is that you liked most would you say diverse scope? You said it was very diverse. You're talking about the scope of practice, right?
Yeah. Yes. Of all the different areas that I was working in, I really liked it.
Yeah, that sounded amazing.
Yeah. Because
go ahead.
right. In one day I could, I was doing some addiction medicine, and then I was going and doing Botox on the next person, and then I was doing diabetes on the next person. So yeah, I loved it in regards to that.
How did you, I mean, did the doctors or supervising physicians, did they help you navigate that? What tools and resources did you use to be able to, work at such a broad scope?
So it was actually a very small clinic. There was only me and then the doctor that owned it. He had owned the clinic for about 20 years, and it was just him and one other provider. So I think it was a nurse practitioner before me that had left a couple months, and that's why they had the opening, and I just happened to apply and get it at that time. So I started by doing kind of just the normal family practice in addiction medicine. And then I would say about a year or so after that, we kind of picked up doing hepatitis C treatment. And I did like a whole training module on that to learn how to do that. And then about a year after that, we picked up a couple laser hair removal machines and Botox training. And they paid for me to go to do that training. And so that was, like I said, the year after that. So kind of everything was kind of gradual added in there as I got my confidence up and learned more that something else was added into the, like I said, the scope of everything we were doing there at that clinic.
Great, thank you. So we did get a question. They're starting to come up here. For pain medicine, can you expand on the care you provided as a PA?
Yes. So basically my job was to, when the patient came in, and being a PA there, I wasn't seeing new patients. It was all follow-up. They would come in, we'd have them do their drug tests. We would just kind of make sure they had all x-rays, any imaging, MRIs, everything up to date on what we were treating them for. And then at that point, if they were kind of happy with the dose they were at and their pain was controlled, then I would just go ahead and say, okay, we're going to continue this current dose. If they did have a complaint that they weren't controlled or it was too much or not enough, then I would have to pass that on to the doctor. And so essentially I wasn't really making any decisions. It was more the doctor that was making decisions. And I was just kind of like the in-between person. So not a lot of independence. The doctor was also doing epidural injections and for pain as well. So there were some procedures, and the mid-level providers were kind of in the background just doing like all the follow-up. So wasn't too much that I was actually doing there on my own.
Do you think if you'd stayed there longer, would your scope have changed within the pain medicine portion, or was it just set up for that, the way that it operated?
I think he basically had it set up for like that there was one doctor at each office, and there was a couple different offices. So it was kind of set up for the mid-levels to just support the doctors in regards to them making all the decisions, doing the procedures. So yeah, it didn't take me long to decide that I definitely wanted some more independence and wanted to expand my knowledge just doing some pain management.
Absolutely. Okay. The other question we have, similar to the question I was coming up with, was the Botox for cosmetic or therapeutic reasons?
It was actually cosmetic, all cosmetic. And I was very surprised for a family practice how many people wanted cosmetic Botox. Of course, doing the Botox actually will help with people that have tension, headaches, and migraines, even doing it in cosmetic areas. So there were people that it was helping their headaches, but they were just paying out of pocket. Of course, insurance doesn't cover the cosmetic standpoint of it. So we were just doing everything. They had to pay out of pocket for cosmetic reasons. So, yep.
I think it's interesting that you started doing those more dermatology type things, and now you're in dermatology.
Yes.
How did that, like, is that just coincidence? Were you interested in dermatology and were kind of nudging them in that direction? Was it coincidence?
That's a really good question. So we got to pick one specialty in PA school on our rotations to do. I really wanted to do a dermatology rotation because I was interested in it and I never got the chance. Dermatology is very hard to get into and it's hard to get students. Like a lot of clinics don't let students shadow, at least the ones that I was trying to, find somewhere to shadow and do my rotations. So I've always been interested in it, but it wasn't until I started doing more of the Botox and cosmetic standpoint of it that I was getting more and more interested in dermatology. Yep.
Very interesting. Any other questions before we move on to talking about the dermatology portion? Anyone?
Diana, there is another question here. The third one.
I think was a follow-up to the original one, which was the scope of the pain medicine portion. Thank
Okay.
you. Yeah. I assume that we've answered. So the follow-up, but you kind of were answering when that one came through, were you primarily refilling and weaning off medication in your pain management role and counseling? But I think, as you said, you were mostly seeing just patients and checking their statuses and then reporting.
Yeah.
I have a question. So,
Yes.
Cassie, when you transferred for this Troy family medical practice, when you said that you were kind of more independent, learning a lot, there was anything like surprising for you that you weren't prepared, in contrast with the training we get in the PA school or something like that?
That's a good question. So the training that I had when I started, and I'll kind of talk more about like my training dermatology currently now, but I was probably following the doctor around for about 3 days before I was kind of pushed on my own. So, and I also had that time off, like those 9-10 months that I was not doing anything when I was living in Germany before I started working. So I definitely did not feel like I knew what I was doing at first. Of course, the doctor that I was with that was at the clinic that I was working at, he was very supportive and I would go to him on a daily basis and I have multiple questions just to make sure I'm not doing anything I shouldn't be doing. So I had a lot of support from him, but we were so busy and it was just him and they needed someone so badly that it was about 3 days. And then I was kind of like on my own and, you got to start seeing people. We need help basically. So there was a lot that I did not feel comfortable with. And I basically just kind of learned things as I went and got more and more confident at doing them. I had the basic knowledge, of course, but yeah, just when you're on your own, it's so different. Like, when you're following somebody around training, you have that backup, but when you're on your own making those decisions, you kind of second guess yourself. And I had him there to answer those questions. So it was nice.
Thank you. My another question is, during these 5 years of practicing at the family practice, do you had any like a challenging case? Like, I'm sure you had a lot of patients and there was any challenging case, and how did you overcome and how did you solve that?
I'm trying to think of like specifics. I know I definitely did. I'm trying to think of anything in particular. Anything that I had, I'd go to Dr. Woodyear, which is his name, the clinic. I would go to Dr. Woodyear and ask for his support. Or if I really did not feel comfortable, I would have him, they transferred that patient over to his schedule. If it was something that which rarely happened, but like I really need his support and him to make a decision on this, I'd go to him. So I'll try to think while we're talking if I can think of any like specific cases I could talk about, but a couple times, yes, that kind of, needed that support from him.
Okay. Any other questions? Again, feel free to unmute or throw it into the chat. Okay, well, we'll open up for questions more later if anybody else has anything comes to mind as we go. So tell us about dermatology.
Okay, so I was not actually actively looking for a job. It was just happened to be the time that my contract was up at family practice. My younger sister, she's 6 years younger than me. She is a PA as well and just graduated a couple years ago. she was working, she works for the VA and does disability exams for veterans. And she had a patient that was the current provider at the clinic I'm working at right now. Now he's retiring in about 2 years, and they were looking for somebody to kind of fill his position. So it just happened to be that word of mouth, she had him for a patient and was asking, around, do you know anybody? Do you want a dermatology job? Like, we're looking for somebody. And so it just, everything worked out at this exact time that I was done with my contract, and she passed that information on to me. And I gave him a call, and that was probably about March or April of this year. And a week later, I went up and spent like a half a day shadowing. So I was obviously very interested in dermatology. I had always been, but I didn't really know exactly. All dermatology offices are different. There's more like cosmetic dermatology, and then there's more dermatology dealing with psoriasis and, rashes and that kind of thing. So I didn't know what kind of clinic it was, how they operated, and I spent half a day shadowing and really liked it a lot, and kind of made my decision a week later that that's what I wanted to do. So he is not the one that owns a clinic. There's about 6 clinics. There's one provider per clinic. And then there's Dr. Polly, who owns all the clinics, who's kind of in charge of all the clinics. And he is retired. He's not working, but he manages everything. So after I had done my shadowing, I got in contact with him and just did a couple phone interviews as well. Everything was over the phone, and I got offered the position. So it was in May that I started this year. And how the training is set up. So what I really, really like about this clinic is the training is about a year training. So you're training with somebody for a whole year before you're on your own and actively seeing patients. It'll probably be, actually, it won't be a full year for me. I'm going to be done in March or April. So it'll be about 10, 11 months. I'll be done with my training a little bit early. And at that time, the nurse practitioner that's training me currently, the one that's retiring, will leave, and then I will just be the sole provider at that clinic. So it is all mid-levels that work at all the clinics, and it's 1 mid-level per clinic. So all mid-levels that are working, 6 of us total, and he will be gone and I will be on my own at that point. And my training at first, I'll kind of talk about, just consisted of following him around. Probably for the first month, I'm just going into rooms with him, studying, of course. There's a couple different materials that they've given me to kind of study visual on the computer, as well as like textbooks. So at first I was definitely spending at least an hour or 2 every night kind of reviewing everything I seen that day, looking at photos. Dermatology is obviously very visual, so it's a lot of like going back and looking at photos and textbooks to kind of learn and remember what certain things look like. And of course, different rashes look different on everybody. So, a lot to study there. So I probably did that for about a month. And then for a month or 2, I started going into rooms on my own before him, just kind of getting an idea and seeing if I could kind of get the diagnosis or the treatment plan, medications in place before that. And then I would probably say about October, November, I started just going in and seeing. At that point, he let me see the follow-ups on my own. So I felt confident enough in what I was doing that now I am seeing follow-ups on my own. And then, of course, he reviews everything, but then we can go ahead and just let the patient go. So I'm definitely at that point, very independent, that I'm seeing follow-ups and letting them go finally. And now we're about, I think, 9 months in now to my training. And like I said, I got a couple more months and then I'll be on my own. We do not do any cosmetic dermatology at this clinic. It is all, like I said, clinical based. I guess we call it clinical based. A lot of psoriasis, skin cancer. The clinics actually have something called superficial radiation therapy, which is treatment for non-melanoma skin cancer. There's not very many clinics that I know of, at least in North Carolina, that have that treatment. And it is more superior than even doing Mohs surgery for skin cancer. And it's no pain, no cutting, no surgery. So we have 1 machine per office. And we have also a lot of patients that are coming in to get that radiation therapy. It's about 20 treatments total that you have to get it before that they're all done with it. And of course, we have multiple people with skin cancers at a time. So we're very busy doing that. Of course, seeing a lot of new patients. And we're probably trying to think of how many patients a day we see. We probably see about 50 to 60 people a day. So it's very, very high volume and not enough time to do anything cosmetic. So no cosmetic here, unfortunately, no Botox or hair removal or anything like that I was doing. But I actually am enjoying it even more than the cosmetic standpoint. I think for me personally, it's a little bit more of a challenge, and I like a little bit of a challenge, when someone comes in and trying to figure out exactly what they have, whether we have to do a biopsy to confirm or do some lab testing to confirm what they have. So it's entailing more of that. And also, when it comes to cosmetics, even though I did love doing that, it's very hard to make patients happy, obviously. So it's a little more less challenging in that standpoint, that you're not trying to make people constantly happy, with the cosmetic aspect. Trying to think of what else we do there currently. We don't do any procedures, so no major procedures. If we have anyone that has like cysts that need removed, we do refer out to a plastic surgeon here or a general surgeon that we have in town, because we don't have time to actually be suturing patients up because we see so many patients. The good side about seeing so many people a day is that our wait time to get in is only a couple weeks, where I know a couple dermatologists around us, it's about like 4 to 5 months to get in to see a dermatologist. So we can get people in very quickly. And we have a lot of support from the nurses. So I know some people are thinking, how do you provide adequate medical care when you're seeing so many people that fast? But the derm techs, the nurses, are awesome, and they will actually do pretty much everything for us as far as like charting, taking photos, getting somebody numbed up if we need to do a biopsy. So I feel like I can spend enough time explaining things to people because I'm not spending time doing all the charting, doing the numbing, doing everything like that. So I love it. I really do.
And do you allow
Yeah.
people to come in and shadow you at all, or is that a possibility?
When I'm on my own in a couple months and the current nurse practitioner that's training me is gone, then I probably will have the opportunity at that point, yes, to allow some shadowing. So yeah. And in regards to that as well, my sister, who actually got me the PA job, there is another provider that is leaving. I think it'd be like the end of next year, and she actually did an interview and got accepted. So she'll be working at a different clinic, same company, but different clinic as me. So that's awesome. I'm really excited for that.
Do you get a trainer? That's the big question.
No, actually, the guy that's training me, he has a little bit longer left. He's going to be training her at another location, and then and then she'll be on her own as well after a year. So
you guys can study together. Okay, we got some questions rolling in here. So
okay.
I'll start with Lawrence. How long is each patient visit, and what kind of hours do you work?
Okay, good question. I forgot to talk about that. So the hours are 8 o'clock to 4, and we usually have about an hour and a half lunch. So that's crunching time down even more. It's supposed to be, they put about, I'm going to say 6 to 7 patients an hour scheduled on there. So basically you're seeing somebody every 10 minutes. It's kind of what it comes out to, because they'll double book a couple slots. So about 10 minutes each visit. And some visits are just going over results of biopsies. So you're only in there for about 2 minutes to tell them this is what the result is. It's nothing. Or we spend a little bit longer and talk about if it's skin cancer, the options, the radiation, if they choose to do that. So for some patients, I can spend more than 10 minutes if I need to. For some patients, I'm only spending about 2 to 3 minutes. So if people need it, if patients need it, I can spend that time, but of course not everybody needs it. So it kind of makes up for those longer appointments.
Great. And is it typical to train extensively for specialties?
Not that I know of. I have, of course, I'm trying to think, I don't have any friends or anyone in my PA class that I know that actually is in dermatology currently. And so I don't have, I'm not really sure. I can't compare it to another clinic, but I don't think that year training is typical. I think that's just what Dr. Polly wants all his providers to have, so that when you're finally on your own, that you're confident in what you're doing. So a year is a long time, but I'm very grateful that I am given that opportunity to have that training, because I was not given that at my first two jobs. Of course, it just didn't allow for it, which is totally understandable. But I feel I'm going to feel definitely very confident when I'm on my own, which is a plus.
Yeah, that's great. Okay. And then we have the question, do you have any notion to switch to other specialties in the future?
I do not think so. I can't say for sure. But I don't think I would switch again, just because I had the biggest interest in dermatology into a specialty. If I ever had to switch to something else for some reason, honestly, I think I would go back to like a family practice, just because I did it for 5 years, and I have such a wide scope of knowledge on that kind of thing that I was doing and those topics. So I would probably, if I had to, switch back, but my plan is just to stick with dermatology from here on out.
Do you have any notion to broaden what you do within dermatology? Because it sounds like you have a fairly narrow scope within dermatology right now.
Besides just adding in the cosmetic aspect of it, and of course the procedures, I would like to do more procedures than just doing some simple, what we do is like incision and drainage, biopsies. I'm trying to think if we really do anything else. That's mostly everything we do, like procedure wise. So if anything, I would maybe say like just adding in the cosmetic as in the regards to the Botox, because I know I would have time to do that here, where I know like at this clinic, I wouldn't really have time to do anything procedure wise. It just doesn't allow for it. So, so yes and no to that question.
That's totally fair. Do you have any other questions? Feel free to put them in the chat box or unmute yourself. Meanwhile, I will ask, oh, here we go. Margaret.
I have a question about, all right, so I have 3 kids and they break out with rashes randomly. And when I'm trying to explain over the phone to the nurse, the rash, the way it presents, I always struggle with trying to explain the way a rash looks and how to like differentiate different rashes. Do you have, because I know you said you were studying and practicing, do you have any special apps or websites that you recommend that talk about how to identify one rash versus another, and like how to describe the appearance of each rash?
Yes. So I use Visual Diagnosis, which is like a app. You have to pay for that app, but that's mostly what I've used to train with, because there's so many images under each diagnosis. On that app, you can actually even put in different like morphologies for how to describe it, and it will give you differential diagnosis of what it could be under each one. So I really like that. I believe on that app, which I don't use this feature, but I believe you can take a photo of it and it'll give you differential diagnosis underneath it as well. So that one you have to pay for, but that is the #1 thing I've been using to study. As well as there's another site called DermNet, which is free. It's not as good as Visual Diagnosis in regards to I don't think you can take a photo on there and it'll give you, possibilities, but it's a free option and it's pretty good still with giving different, differentials. So those would probably be the 2: Visual Diagnosis and DermNet.
All right, awesome, thanks. Yeah, I struggle also with like explaining different wounds, like if it's a laceration and,
yes.
So I'm like, just to have practice. I'm also a non-traditional applicant. So my background's in sports medicine, and this is just something I've always struggled with. So it's a weakness I've acknowledged, and it's great to have these different sources to practice.
Definitely. I will say the program that we also use, which is called ModMed, Modernizing Medicine, I believe it's like the full name of the app that we use. when we go ahead and put in a diagnosis, if I know what a diagnosis is, it'll give you a set of morphologies because you have to kind of describe it. So if you're a little bit struggling with how to describe it, it'll kind of suggest certain things and you can change it based on what it looks like. So I think that's also helped me because as I'm learning what the diagnosis is, even though I know what it looks like, actually, like you said, like describing what it looks like is very hard. And that's taught me to describe what it looks like. So yep.
Awesome. Thanks so much.
Thank you.
Thank you, Margaret. That's a really nice practical one. And I actually want to look those up. Visual diagnosis reminds me of the flower identify or plant identification app where you take a photo. It's like amazing what we can do now with all of this artificial.
I know. It is.
Okay, so I have a few more questions for you. Do you feel that it was an easy transition moving into different specialties? And did you encounter any obstacles and challenges with those changes?
I think because I went from family practice to dermatology, I had that, I had a little bit of dermatology experience from family practice. And that's just kind of like the basic rashes, even, you know, shingles and psoriasis and eczema. However, when I switched to dermatology, I thought that I would be better prepared for dermatology from doing family practice. And it was amazing when you go to seeing like maybe one rash or two rashes a week to seeing everybody that has rashes, how much I really didn't know about rashes in dermatology. So I quickly learned that I needed to study and there was a lot that I needed to learn. So it gave me a little bit of a background, but I definitely still felt unprepared when I first started and was like, there's a lot I need to learn. So.
Was that frightening or was that exciting or both?
I think both. I was not, like I said, I was not seeing any patients on my own for like a month or two. I was just solely following someone around. So I wasn't that scared because I wasn't being, you know, like I have to make decisions for patients yet. And I think it was exciting because also this is something new that I'm learning. I was doing the same thing. I know I had like a very diverse scope of what I was doing, but doing the same thing for 5 years. So this is something totally new and I was very interested in it. So it was exciting at the same time.
Great. Okay. And then Lauren was asking, since you will be the sole provider at your clinic, how often will you meet with your supervising doctor?
Usually we have quarterly meetings with everybody. So that'll be about 4 times a year. He does review, it's a certain percentage of charts each month that he has to review and sign off on. And to my understanding, he'll send you back feedback on however many charts he has to review on if he agrees, doesn't agree. And we take photos of almost everybody that has like rashes, acne, anything like that in the chart. So he has access to looking at like what the picture looks like. And then of course, any biopsy results and then what we did. So that's where he recommends what we need to do, or, you know, do this, do that. You're doing a great job, that kind of thing. So.
Are you sort of sending those particular charts up to him to say like, I'd really like you to review these, or is he sort of randomly picking that percentage of charts?
I believe he randomly picks them. And I do know, like I said, for at least another year, the provider that's training me and the provider that's training me, he's done dermatology for, I think, 15 years, at least 15, 20 years. So he's very, very good at what he does. I have him for support, and he has already told me if there's anything that I have questions about that I can reach out directly to him. And he is a little more accessible because he's at the clinics where Dr. Pauly's now retired. So he doesn't actually even stay close to the clinics at all times. He's traveling and doing other things. So.
Okay, now we have a very technical question about salary, because this is one of those things we don't actually get a lot of information about. It's one of those things that's behind the scenes. So however you are, whatever you're comfortable sharing. But how does the payment or salary work? Is it hourly per patient? Is it an annual salary? How does it, you have 3 different jobs, so you have a little bit broader perspective on what that could look like.
That's a really good question. I'm very like transparent about that because that's something like I would be very interested in as well. So I have no problem answering the question. Of course, the first two jobs were salary based. So my first job, I wasn't there for longer than a year, but it was a set salary. My second job was a set salary with I believe it was a $5,000 increase each year that I was there in that 5 years. And so this job is, and I do know I'm a part of a couple of groups on Facebook for dermatology, and I see this question a lot. It's mostly percentage based. So this first year while I'm training, I am a set salary. And then when I'm on my own seeing active patients, it's going to be, I believe, 15% of the patients I see is what I make. And I can go into more detail of like how much that is if people are interested. Like I said, I'll be as transparent as you want me to be, but I believe an average of what I see online is like 15 to 20% is average for dermatology specialties to make.
What does that mean, like, of the amount that's billed to the patient, insurance, whatnot?
Correct. I can't say 100%, but I believe it's like the net of what the insurance is being billed. So it's kind of like the net of what they're making at the clinic of everyone that I see that month. And we are paid twice a month. So that would be like every 15 days, every 15 days.
I have another question regarding the salary. So the end of the year, like roughly that, do you earn more money by salary based pay or the percentage based? How does it like, or the roughly it's the same or there's a big gap?
There's a big gap, and it'll be definitely more percentage based, which I think is why I believe most dermatology specialties are percentage based, more percentage based than salary based. Yeah.
And percentage wise, I think you probably will be more motivated to see more patients, correct? Than salary based.
Correct. Which is also definitely, I'm sure, a part of why a lot of the providers here see so many, because obviously there's a cap at, I don't think they will schedule more than like 65 or 70 a day, but the more patients you see, the more percentage you get, the more money you're taking home. So definitely.
My another question is, it's regarding insurance. So you probably see the private insurance and you see the government subsidized insurances, So which type of patient, like in terms of insurance, that will give a more return, like a private one or the government or the same? Or you set up the rate or?
I'm not positive about that. That I don't know. I don't know that much about, like the billing and if, Medicaid, Medicare will pay more than like a Blue Cross Blue Shield. I do know at the clinics, we see a wide range. We even have TRICARE, because we have a couple offices in Fayetteville and there's a base in Fayetteville. So there's a lot of TRICARE military that they're seeing. We see a lot of Medicaid, Medicare, and then obviously commercial insurance as well. So I would say between government and private, we would see probably like 60% government, and then I don't know, like 30-40% private insurance.
Thank you.
Thank you.
That's the question, Shanar. Okay, so we'll do one last, well, unless more show up. I have another salary-based one. Does your employer offer bonuses?
He does not, because the pay is really good at the clinic I'm at. So, and I have not had obviously any percentages to know exactly what, that amount is, but I will tell you that a lot of the providers will make at the clinic over 200,000 a year, in just regards to that being about 15 to 20%. So because the pay is so good with just like the percentage, there's no bonuses.
Sign me up, just kidding. So we're gonna switch tacks for a minute, unless any other salary questions come up. Thank you so much for sharing about that, because it is sort of like behind the scenes. We don't always know what the variations are.
Of course.
So Hadil has asked, other than you wanting to become a PA based on shadowing your friend's parents, what is another reason you chose the PA route?
Good question. I think the main thing that was appealing to me was being able to pick a specialty or, a non-specialty and then change if I wanted to at any point, rather than committing to doing medical school, which obviously is a lot more schooling, a lot more student loans. If there they have to pick a specialty and then stick with it. Whereas being a physician assistant, it is awesome that we can change at any time and do pretty much anything, any specialty, anything that you want to do, work in a hospital, work in a private office. So I really like that flexibility.
And I'm going to add on to that because a lot of people are trying to discern, do I want to be a PA? Do I not want to be a PA? Trying to figure out how to phrase this. What kind of person really excels at being a PA, or what are some of, the key reasons that you would recommend this profession versus some other medical profession that one could pursue?
That's a good question also. I knew I wanted to do something medical. So besides the fact that, and that, I guess me picking something to do medical, I have like that need to want to care for patients, provide care for patients. And that kind of goes back to me being, I'm the oldest of 4 children. I've always had like that motherly instinct. Compassion for people and caring about people is probably like the number one thing that made me say I wanted to do something medical. And then from there, kind of choosing PA based off of being able to switch around and do different specialties. But I mean, I don't want to say, there's set characteristics that certain people have to be a PA, because we're all different, we're all diverse, and a lot of people are good medical providers. So that just for me is kind of why I was led in this direction.
There any, like in your cohort, did you notice any other, I guess I'm kind of trying to get at, like, is it why that's, the specialty changing is huge, right? So if we were to get to the heart of what's behind that, it's the continuous learning. Is it, like that mental piece where you're just interested and you're intrigued by the world, that you need to have changes in the, that where you're, what you're learning and what kind of work you're doing, like things. I'm trying to get to the heart of that. Like, what is it about that is really appealing to you and why you made that choice? Does that make sense?
Yes, definitely. So switching from family practice to derm, definitely number one would say the challenge of learning something new and kind of scratching that itch where I was always interested in doing dermatology, but I never got to do a rotation in it. And so I didn't really know if I would have done a rotation, I maybe would have applied to dermatology jobs. I will say a lot of dermatology jobs require, that I've seen online, they require a year or 2 of experience that are out there. And that's really hard to get a derm job if you don't obviously have any experience in it. So that would be number one. Number two is I just got the option to switch. I know it's so hard because of that reason to get into dermatology. And I definitely was going to take that when I had the opportunity to do it. So
I'm wondering what you would recommend if somebody wanted to get into, like, they were passionate or interested in dermatology, right? And whether or not you get a rotation, maybe you choose a school that has a rotation in dermatology. But would you recommend people work like as an MA in a dermatology office? Like how would you recommend people go about feeling out these kind of specialties that they might be interested in, that are a little bit harder to break into?
I would say it's hard because definitely a part of it is having a connection and knowing somebody to get in at least in regards to dermatology. So it's really hard to be able to just apply without having some sort of connection. I think, like you're saying, having some sort of being like a derm tech or a medical assistant first, or maybe doing something like I did where you could do cosmetic dermatology, which I heard is maybe a little bit easier to get into because it's becoming a really popular thing to have, like, all these med spas and do cosmetics. So maybe going that route and then applying for more of a clinical dermatology job. That would probably be the best way. Unless I know if I would have gotten into like being able to shadow, again, I would have had a connection on maybe someone recommending, somewhere to go to get a job to begin with.
Yeah, it's complicated. You just kind of take it one step at a time, right?
Yeah,
Samhar asked, you said you were being trained by an NP, correct?
correct.
How do your roles differ at all?
I believe for North Carolina, just in regards to like dermatology, there's no difference at the clinic that we're at currently. Now I know just in North Carolina in general, and this will like vary per state, nurse practitioners are able to, and this might be for all states, I'm not sure. I think they're able to have their own clinics and own their own clinics where physician assistants have to be under an MD. So in where I'm at currently, there's no difference in being a PA or nurse practitioner in regards to other aspects. He would be able to have his own clinic where I would not be able to.
And then let's see, Cami has a question. In hindsight, did you think that dermatology specialty was competitive to get into amongst your PA peers while in school? Was this a specialty that most PA students wanted to get into for their own reasons?
So I'm sorry, I just want to clarify when we're asking why not that many PAs.
Do you think it was competitive to get into amongst your PA peers while in school? So did anybody else want to go into dermatology? Did anybody else pursue that route?
Honestly, from what and like I said, I think there's like 50 or 60 people in my class. I don't know anybody that actually had a chance to do a dermatology rotation. Now, I don't know everyone, what everyone did for all their clinicals, so I'm not 100% positive on that, but I can't think of anyone off the top of my head that had the chance to do a rotation in dermatology.
Do you know if any of them have gone on to do dermatology?
I don't believe we do still have like a Facebook group for everyone that I graduated with. From what I know, just being mutual friends with people online, I don't know anyone else that's in dermatology currently.
I'm actually curious, what clinical rotations did you do when you were in PA school?
I did 2 family practice. They required 2 family practice. I did the emergency department. I did pediatrics, OBGYN. I did a surgery rotation. My specialty that I got was orthopedics. And I'm trying to count how many that is. Internal medicine. That's the only other one I'm forgetting. So that was all of them.
Did you feel like that was good preparation for maybe your family practice specifically, that work?
I did, because we did 2 rotations of family practice. It was required plus internal medicine, which is very similar. So I do think that that was, I guess that was essentially 15, 16, 17 weeks of just doing family practice. It was good. It was good preparation for it, I think.
Do you do any rotation in mental health?
Oh, I did forget. Yes, I did have a psych rotation as well. Thank you. I did forget that one.
All right. Any other questions for Cassie?
I have a question. Cassie, is there any like a differences between like work and personal life balance, working in family practice in the dermatology, or you're kind of it's the same?
So the only difference I would say, when I was in my family practice, we had to be on call for just like emergency calls. It was every 3rd month. So basically for the full month, we would get a link or like a message that a patient called, we had to call them back and address something, whether like a medication didn't get sent in or they want to know if we need them to go to the ER, whatever it would be. So I had to be on call and be available for that every 3rd month. That I don't have anything like that here. Work-wise, I would say charting-wise, I mostly did not have to take anything home in family practice. I was getting mostly everything done at lunch or by the end of the day. So all my charting, obviously at family practice, was done by me and it was done. Here, I don't have anything yet that I have to take home because luckily we do have the derm techs that help out with a lot of the charting. So they'll put everything in. Of course, I have to send medications in and sign off on it, but it helps cut down the amount of work tremendously at home. So I'm not bringing anything home to work on here as well.
Great. Thank you so much, Cassie. So it's the top of the hour. And so I think we're going to wrap up here. Thank you so much for giving us your afternoon, I guess, where you're on the East Coast.
Thank you.
It's morning for me. So glad to have you here. And thank you for sharing your story and your experiences. It's been wonderful to have you.
Thank you so much.
All right. Take care, everybody. We hope to see you next time.
Bye, thanks.